Students in Ontario will not get an extended winter break because of the pandemic. Yesterday, the province's education minister suggested there was a possibility that schools would be closed for a period in early January. Today, Stephen Lecce issued a statement saying, "We have consulted with the Chief Medical Officer of Health as well as the Public Health Measures Table and have determined that an extended winter holiday is not necessary at this time, given Ontario's strong safety protocols, low levels of transmission, and safety within our schools." Lecce went on to say Ontario schools have been remarkably successful at minimizing outbreaks. For more on this, I want to bring in Dr. Dan Flanders. He's a pediatrician and the director of Kindercare Pediatrics. And Dr. Flanders, thank you very much for joining us. So what's your take on that statement from Ontario's education minister?
Well, generally speaking, at the current stage that we're at, I'm generally concerned that we're not doing enough, and what we're doing is a little bit, is not quite quick enough. We're not quite getting ahead of this. So far, the virus is getting ahead of us. So I feel like we're behind an 8 ball, and I think we need to do something decisive. We need to do something quickly, whether or not it's with the schools, whether or not the action that we need is in schools, that remains to be seen. But I'm really craving the government taking some decisive, quick action to get this under control.
Well, what would you like? I mean, I know, I guess I'm asking you the impossible question, but do you think, like, you look next door to Quebec, there's some talk that maybe they're going to have, an extra long holiday. People might be getting together at Christmas time. They may even allow it, or it might just kind of happen. And so you should have an extra period of time for people to stay home. What do you make of all that?
So as applied to the schools, I'm not sure that the intervention targeted specifically at the schools is going to have a large or a major impact on our overall numbers. But making interventions that target the population sort of across the province. So extending the Christmas and New Year holiday for 2 weeks for everyone, where everyone stays home, and every member of the community possible stays at home and isolates. I think that could have the impact that we're looking for. I'm not sure targeting schools specifically is going to be as impactful.
That's interesting. So what have you been observing in terms of COVID-19 transmission in Ontario schools? How big of a problem is it, or has it been, generally speaking, pretty good in terms of keeping it out of the schools?
Right. So I don't think you can directly say it was good or it wasn't good. Generally speaking, there is some transmission in the schools, but I don't think it's the predominant means by which COVID has been really multiplying through our communities. So my impression is that the outcome with getting the kids back to schools has been relatively successful, certainly better than I expected. But there is transmission in schools, and we can't let our guard down.
We heard a lot of warnings from officials before Thanksgiving, and yet there was a spike in cases after that. Looking ahead to Christmas, what would you tell parents who are thinking about their plans for the holidays?
Yeah, so I think the whole province, everyone in all of our communities, in all of Ontario or all of Canada, needs to get a really clear, resonating, consistent message that we should all stay home during the holidays. We should not be mingling with others, not be doing anything that's not completely essential. So that we could really prevent catastrophic spread of the virus over the next few months.
Dr. Flanders, thank you. That's pediatrician Dr. Dan Flanders joining us from Toronto.